Chantal Mathieu. I'm an endocrinologist from Leuven, Belgium. A group of experts put together by ADA and ESD have worked for more than 1 year now, looking at the evidence on the treatment of people living with type 2 diabetes. And so we worked very hard to look at what was now coming out of literature to change the way we are treating people with type 2 diabetes. And what was evident is that we need to be more proactive in our holistic approach of people living with type 2 diabetes. So the big conclusion is that we should be more aggressive in introducing lifestyle changes, medical nutrition therapy, physical exercise, together with education early on in the treatment of people with type 2 diabetes, and consider introducing medication early on, as soon as diagnosis, namely SGLT2 inhibitors and GLP-1 based therapies, depending on the risk profile of the individual, depending on the glucose and the weight goals of the individual, and also depending on the cardio-renal metabolic risk of this person. The holistic approach of people living with type 2 diabetes has been central in the ADA-ESD consensus versions over the last years, and it's not different now. Again, the person living with type 2 diabetes is at the center. He or she is an integral part of the team responsible for treating people with type 2 diabetes, and we need to be holistic in our approach. Namely, we need to look at the full profile of the individual. Yes, the glycemic goal, yes, the weight goal, but also the overall cardiometabolic risk. And by that we mean having attention whether the person has a very high atherosclerotic cardiovascular disease risk or already has had events, whether heart failure is present, whether chronic kidney disease is present, and now what is new is also whether muscle, so the metabolic associated steatotic liver disease is present. And what we say is be proactive from the beginning. In most people, from diagnosis, introduce lifestyle interventions, education, and medications that are not only effective in lowering glucose, in lowering weight, but also in protecting the heart, the kidney, and the liver, namely SGLT2 inhibitors and GLP-1 based therapies. What is obvious from these sessions is that we need to look at the whole person living with type 2 diabetes. There were a lot of presentations on new trials reading out where GLP-based therapies, for instance, different combinations, GLP-1 receptor agonist with glucagon agonist, with GIP agonist, etc., were presented, all presenting dramatic effects on weight, also important effects on glucose lowering, but importantly also effects, for instance, on steatohepatic disease, and that is very important. Also, other chronic diseases like the obstructive sleep apnea, for instance, was a point of attention here. So overall, big arguments from all the new evidence to be proactive in our care of people living with type 2 diabetes. Do not waste time, no clinical inertia, but early on in the diagnosis, introduce agents that can protect the organs of the patient. And I'm very proud that at the ADA sessions I got the Distinguished International Service Award in the cause of diabetes from the ADA. The title of my award lecture was Unity Makes Strength, and it was really a call out to work together globally, all over the world, in our initiatives to improve getting the care, the proper care to people living with diabetes, and also a call out to work together in our research, basic research and clinical research. Close to my heart, of course, is finding a prevention or a cure for people with type 1 diabetes. And so I gave some illustrations how in Europe we were able to work together in initiatives called Inodia or Identify to really bring together researchers, basic and clinical, academic and industry researchers to work together on organizing screening for type 1 diabetes and also trying to research biomarkers for type 1 diabetes and getting trials executed on disease-modifying therapies in order to prevent or cure type 1 diabetes. Unity makes strength.